Hello audience, my name is Sarah and I'm a co-treasurer on the Medical Society, and I am absolutely thrilled to bring you this first episode of MedPod. It is what it says on the tin. We're just going to be talking about medical related issues, discussing common misconceptions, as well as bringing on guests that are well versed in their fields to get at the essence of what we are as living, breathing human beings and everything that surrounds that. So just a teensy disclaimer before we actually get on to the main stuff. Of course, we are compiling these episodes with as much research evidence as we could possibly get with our computing power. But of course, we are not qualified medical professionals, so we can't advise on specific health problems. We're mostly here to raise awareness, that sort of thing. So anyways, you might be wondering why I'm wearing a fair bit of red today, and it's mostly because this month is National Heart Month, actually, and we've got Valentine's around the corner for anyone celebrating, unless you're doing Galentine's, of course, or any kind of tines, just about. But today we're going to be looking at how the heart works, what it does, as well as a history of treating heart conditions and how we can prevent them in the present day as well. So the heart is an interesting thing from many perspectives. For eons, it has been helping our organs, our movement, our overall function, and artists, all the creatives, have brought just about every meaning they can into the heart. It's a very rich organ. Movies, directors have sent many a character onto navigating messy emotional paths through their stories in terms of love. But we're going to be cracking down onto the real thing, whether the first thing you're thinking of is the emoji or the anatomically correct version. That's what we're going to be on about today. It's been estimated by the World Health Organization and the Heart Research Institute that as of 2019, 17.9 million deaths globally have occurred because of some form of cardiovascular disease. Millions. That is quite shocking to comprehend, so I'll just let that take a moment because it's important to acknowledge just how devastating that can be. So in terms of how the heart itself works, we have the vena cava. So this is a vein, and we've got a superior version, inferior part, and they both feed into what's called the right atrium. And this is a section of the heart from where the blood can essentially leak and then flow into the right ventricle, from which it is pumped right out into the pulmonary artery to the lungs, where it gets the oxygen that it needs to go eventually back to the rest of your body. So after it's gone into the lungs, it's all oxygenated now, and it enters via the pulmonary vein into the left atrium, and from there the left ventricle, and then pressed out into the aorta, which feeds the rest of our body and the systemic circuits. Common heart conditions experienced by many of these patients have included arrhythmias, so that just includes irregular heartbeats, as well as a congenital heart disease, which babies are born with, as well as coronary heart disease. Diabetes is also an important one to mention because it is such a complex multifactorial disorder, including genetics as well as the environment. So it's just another one that maybe wouldn't automatically occur to you, but it is definitely part of the list. In terms of our history of treating these diseases, it spans way back honestly, we have records from 3000 BC, from ancient Egypt, talking about angina pectoris, which is just essentially not enough blood supply to the chest, which causes pain in the chest. And we've also had really exciting breakthroughs in the 1950s, which brought heart surgery away from just palliative treatments for those who are, deemed to be at, sort of end stages of life, or with really debilitating conditions alongside the heart condition. And in fact, the 1960s brought a surgeon called Christian Bernard, who in fact performed the world's first heart transplant, which is amazing. And so 70 years on, we've taken those innovations and breakthroughs into the present day, and we've been adding to them with less invasive treatment options from a variety of drugs and blockers that specifically target specific proteins to essentially ensure that the blood flow can occur normally. So we're now going to talk about environmental factors and a variety of other things that play into our lives, because the heart is so much more than just this thing sitting in our chest, or the mediastinum, I should say. That's a specific area, not the name for the chest. I know. So these factors, in fact, there was a study conducted by Roth et al., and this is just a great example of how the heart has connected so many scientists from all over to understand how the things that we've brought into our lives affect how the heart works. So everything from high blood pressure to diet to alcohol consumption, BMI, those all interplay with the heart. And it's really important for us, crucial even, to understand that these factors play in. So over here we've got essentially just a quick visualization of what I just said to help bring that into perspective. So the environment is not just the physical things around us, it can also involve interactions with others. So have you heard of broken heart syndrome? Because that's not just for the movies or good song material, if you thought it was. It's actually a medical condition, and it's known also as Takotsubo, hopefully I pronounced that right, syndrome, or stress cardiomyopathy, to be a little bit more formal. And the idea is it's a weakening of heart muscles because of stress. And typically it's associated with emotional stress, hence the nickname, broken heart syndrome. So it really just goes to show that it's not only the physical things, it's also how people around us can shape us as well, and our health. This actually leads me on to a fantastic study that was conducted in Nepal in recent years. Essentially what they were doing, so they helped treat patients with heart conditions, and then they split the patients into groups to either provide them very structured sessions talking about how to care about their heart health post treatment or post surgery, depending, while the other group was provided a brief bit of information, a couple of leaflets, and hey ho, there we go. So the group that received the structured counselling and the group sessions to talk about how they can move forward with improving their diet and physical health, for example, they saw massive improvements after 6 months on both those factors, as well as reduced alcohol consumption and smoking, and a few other factors that you can find out a bit more about in the paper. We'll post it at a point. So on multiple levels, this study is great because, for one thing, our research databases aren't as enriched as we'd like them to be in order to be able to definitively address health issues, because so much of the data that we have it doesn't account for other communities and other continents at times. So it is absolutely vital that we continue scientific research to ensure that we can provide the best care possible for patients. And that is, in fact, one of the 4 pillars of medicine. We have beneficence, so ensuring that we can provide the best care to benefit patients at our core as as eventual medical professionals speaking. Another problem that we have with current research databases, although they are improving, is that sometimes we don't have definitions and clear criteria for what we need to address patients at different levels, different disease states. Because another factor I mentioned earlier, in fact, high blood pressure. Now, blood pressure variability can be really predictive, actually, of things like coronary heart disease as well as heart attack. So monitoring blood pressure is essential for people who may be worried that they are hypertensive at times, because we don't at the moment have the most definitive criteria to say, okay, this is a normal physiological state, or no, this is actually a pathological state. If we can conduct research in a way that can change these ambiguities, then that can really aid clinicians and patients, of course, because they are at the heart of all medical research. Another illustration of where our databases have been lacking at times is where oxygen meters are concerned, the ones that are used to measure oxygen concentrations in the blood. In hospitals, they have been shown to differentiate based on or provide slightly different levels of different oxygen readings based on melanin content in the skin, and that of course leads to medical bias, which means the specific patients can't receive the best care because they've not been monitored in the same way. I'm glad that today we've had a chance to not just talk about the heart, but talk about everything around it, because again, the heart has an effect. You have an effect on your environment, but it can also come back to you, so we need to be careful of how that works. So I've already addressed factors such as high blood pressure, high BMI, that kind of stuff, but what's around us in our everyday lives definitely plays a part. So even beyond things like alcohol consumption and smoking, diet plays a significant role in heart diseases to an extent, because very commonly we have ischemic heart disease, which is essentially to do with the vessels, and that they become weaker. And this is commonly because of what's known as atherosclerosis. So this long word essentially refers to build up in your blood vessels. So this can be fatty deposits, or blood clotting, fibrous plaque. Yeah, it's commonly referred to as plaque in the papers, but yeah, that's mostly what it's made of. So the fatty deposits that can build up in your arteries, for example, are evidently come from the diet. So how much fatty food we consume can be influenced by things like advertising. So in certain areas where people are at sort of lower socioeconomic advantage, or rather disadvantage, they may see more advertising for fast food chains. There may be more fast food chain pop-ups available to them within a short walking distance. And this is quite problematic. So accessibility is high, availability is high, awareness is high for unhealthy foods. And of course, in recent years, we've had things like the sugar tax brought in, for example, which not only helps heart health by, slightly reducing the potential that a person can have increased fasting glucose concentrations. That's another factor playing into heart disease. But also aids our oral health. And in fact, a little tangent. Oral health and heart health are very interconnected, and it's been proven in multiple studies that periodontal disease, so that's just gum disease in layman terms. So gum disease and heart disease are very much have a very much bi-directional relationship. That's the word. So that means one can affect the other and vice versa. And we've seen this, and it just really shows that aside from pumping blood to the head, the heart and the mouth are also connected and therefore really important to each other. So beyond caring for diet as well, we do need to take care of our oral health and our physical health as a whole. So it is difficult to address all of these problems. I've just loaded on so many problems and issues that we have with databases. I haven't even gone into the fact that BMI is not even as reliable determiner for obesity and risk of other heart conditions down the line. That's a whole other can of worms. But with all of this piling onto us, it can feel quite burdensome. So ensuring that we're not harming our mental health by becoming anxious and worried and scared and fearful about all of this, we can talk about all this. It's important to talk about these issues with people that you trust, and raise awareness about heart health, because we're at the heart of, okay, you know what, the universe, we've been told by physicists that we are quite insignificant in comparison to the rest of the universe. Like, we are a teeny tiny speck in comparison to even the 5% of the universe that is actually known. But on this earth, we are stupendously significant to ourselves and each other. So we really need to take care of ourselves and each other. And by caring about our hearts, we are all connected. That care for our heart health and ourselves, that transcends any boundaries we could possibly place. However, parting is sweet sorrow, as Shakespeare's most famous and tragic couple will know. So with that, I'm going to sign off, but my heart will go on and on. Celine Dion. Thank you. So thank you everyone for listening to this first episode. I sincerely hope that you will enjoy it, take something away from it, or spread the word. If you do all three, fantastic. So we are cultivating our team of amazing life sciences students, hoping to be part of these episodes. And we'll be bringing on more guests and, of course, hoping to bring about a different range of episodes. Many thanks to Smoke Radio as well for bringing this to life. Thanks to AJ and Melanie for recording it today as well. Fantastic job, guys. Thank you. So that's been me. My name is Sarah, and it's been MedPod. Hope to see you next episode.